Assalamu alaikum everyone. My name is Maheen Imtiaz. I'm a first year BDS student from Lahore Medical and Dental College. So, the topic of my presentation is exploring the correlation between dental health and mental well-being. So, firstly, the correlation between mind and mouth is that oral cavity serves as the primary gateway. Food ingested or microbes entering and various dental hygiene practices all amalgamate to create an impact on overall physiological and psychological well-being. The key components and the key areas that are going to be discussed in this presentation are oral gut-brain axis, effects of stress on dental health, drugs and their impact on oral health, anxiety and phobia related to dental checkups. So, firstly, oral gut-brain axis. It is the bidirectional communication network linking oral cavity, gut and brain, immune system, hormones, and microbes with imbalances, dysbiosis in oral or gut microbes can trigger systemic inflammation affecting brain function and mood. So basically this diagram is very important. It discusses about the oral gut-brain axis and tells about the correlation. So if oral microbiota is in imbalance and there is periodontal disease, gum disease, dental caries or dysbiosis, which is basically caused by poor oral hygiene and untreated imbalances, microbiome or metabolite transmission will occur through systemic circulation and swallowing, which will lead to gut microbiota dysbiosis and systemic inflammation and oxidative stress. These three factors are going to increase, which will in return reduce the barrier integrity and will lead to certain diseases, for example, gastrointestinal diseases, systemic diseases, cognitive or brain function decline, mental health issues, accelerated aging. Now coming towards the part where there is maintenance of good oral hygiene and dietary intervention, for example, the consumption of proper functional foods, maintaining a healthy and balanced diet, and consuming proper probiotics, prebiotics, fiber-rich foods, it will lead to oral dysbiosis to reduce and in return cause gut dysbiosis to reduce, which will in return cause a decrease in systemic inflammation and oxidative stress in the body, which will improve the barrier integrity. The barrier being discussed here is the blood-brain barrier. So it will cause improved oral health, improved gut and systemic health, improved cognitive function, improved mental health, and healthy aging. Moving on, the impact of stress and cortisol on the oral health. So what happens is that when there is high stress, it increases cortisol levels in the body, which may lead to different forms of manifestations. For example, bruxism, which is grinding teeth and clenching of jaws tightly together, nail biting, consumption of sugary foods that may lead to a greater risk of caries, gum canker sores, and temporomandibular jaw pain. Now, this diagram sums up the cyclical relationship between oral and mental health, which is that if there is any form of anxiety or depression, it will lead to certain eating disorders, which will cause a greater tendency to consume sugary and fatty food, which leads to formation of plaque. That will lead to a greater risk of dental caries and cavities. That in return causes bad breath, which is halitosis. Furthermore, dental anxiety and dentophobia is a very important key factor which is going to be discussed. Dentophobia is a fear of the dentist. People with this phobia may avoid dental visits, delay their treatments, and experience increased pain, discomfort, and disease progression. Fear often relates to certain past bad experiences, pain, trauma, or aesthetic concerns which makes them conscious. Over drugs and their impact on dental health. Antidepressants may lead to xerostomia, which is dry mouth, bruxism, potential bone decay. Psychostimulants may cause gum enlargement, erosion, and ulcers. Antipsychotics may lead to increased gum swelling, bruxism, teeth grinding, and movement disorders, for example, dystonia. Mood stabilizers, for example, lithium, may cause dry mouth, increased risk of caries, and taste changes. So proceeding further, a survey was conducted in the United States by Delta Dental in April 2023, which gathered statistics showing that 37% of people say oral tooth pain intensifies feelings of depression, 57% claim that they feel really conscious about their oral health and appearance of their teeth, 60% were very worried about being negatively judged and criticized on the appearance of their teeth, and 80% said that the simple act of smiling can make them feel happier. Sara Shavadia, president of Delta Dental, claims that the link between mental health and oral health is really powerful. She says that these results show us that addressing mental health is crucial, critical, especially as it relates to its impact on our oral and overall health. Everyone, regardless of age, ethnicity, or gender, should feel uninhibited to smile and take care of their whole selves. Solutions for creating awareness are workshops and seminars for healthcare professionals. Integrated clinics should be established where cognitive therapists and dental hygienists collaborate. Number three, counseling sessions to emphasize the importance of oral health both for psychological and physiological well being. Moreover, public awareness through social media and community programs, training dental professionals to recognize anxiety and use patient friendly communication, and lastly, integration of mental health awareness into dental services. So, the key message is that a healthy mind supports a healthy mouth, and a healthy mouth boosts confidence and well being. Dental care should address both mental and oral health. Thank you.